Today I'll be presenting our paper, Computer-Aided System for Breast Cancer Region Segmentation and Classification using ultrasound. This is our table of contents, so let's begin with the introduction. Breast cancer was ranked first in incidence rate and the prevalence among other cancer types in the world in 2020. Also, it was ranked 5 in mortality rate. This graph shows that the prevalent cases are high in developed countries. Also, the incidence rate are very high in developed countries. But in contrast, the mortality rate, which means the risks of breast cancer, are very high in developing countries rather than developed, which lead up to our problems that in developing countries, there are lack of resources in both treatment and diagnosis of breast cancer. So our objective is to develop a CAD for healthcare provider to improve the screening and diagnosis of breast cancer using ultrasound images, also to decrease the need for unnecessary biopsy and X-ray imaging methods. But why ultrasound? Although the mammography is the gold standard, because ultrasound is cost-effective and widely used in the developing countries. It has no ionizing radiation. It's portable, flexible, and it's preferred for women with dense breast. Also, the B-mode ultrasound is a viable option for developing countries. So with literature review, we found that some paper with enhanced small tumor aware network is proposed a new architecture containing two encoders, the basic encoder with downsample the input feature to collect the special information in the image. Also a special encoder which is a stand encoder which uses a small kernel sizes to detect the small lesion and narrow the perspective field. This segmentation approach achieved an average of 91.5 dice score on a small dataset containing 725 ultrasound images. Also, attention-enriched deep learning model proposed a new approach, which is Sunlight map, as you can see here in the last image. Sunlight map refers to an image map containing the area of interest that more likely to attract the radiologist visual attention. And here we can see that the Sunlight map, it's basically a unit, but with additional attention block containing the Sunlight map. This segmentation approach achieved a very high result on average of 90.5 dice score, but also in a very small dataset containing 510 ultrasound images. For the classification, Hovertrans proposed also a new transformer architecture containing vision transformer with additional patch embedding, which will give the architecture appropriate knowledge to with anatomical appropriate knowledge into the model. Where this classification approach achieved a very high result. 92.4 AUC on on a large data set containing 2,405 ultrasound images. For our method, we try to collect data set as many as possible. And here we can see that our transducers, there are variability in the frequency range and variability in the devices, and also has a large number of data we have, which is 6,319 images collected from more than 2,043 patients. And this is an example for our dataset containing the variability of our images. For our AI pipeline, we began with pre-processing. We used the resizing and black border removal for some of the images, and we used bilateral filtering and adaptive histogram for improving the resolution of the image. Also, for the augmentation, we use augmentation to increase the number of data we have, while we use the blurring, random brightness, random gamma, translation, and random throbbing. Then we fed the data sequentially to both our model classification and segmentation. For the classification model, we are using the new EfficientNet version 2, and we apply transfer learning. For the data used for the classification part was 2,804 samples from 4 different data sources. For the loss function, we use the cross-entropy loss, and we use decaying cycling rate. For the splitting, we use the traditional 80-10-10 splitting. And our model trained for only 14 epochs as we use the stopping. This graph illustrates that the important and the efficiency of FlashNet version 2, showing that it's efficient in training time and accuracy compared to other models. This graph was trained on the ImageNet, which contain more than 40 million image. And here we can see the number of parameter is very efficient compared to other models. For the segmentation part, we used the attention unit architecture. For the data used was all of the data we have, which is 319 images collected from 5 data sources. For the loss function, we use the log cosine and comp loss, and for learning schedule, we use the cosine annealing. The splitting, we use the traditional 80-10-10, and our model trained for 75 epochs. This is the architecture of the attention unit. As you can see, it's basically a unit with attention gates, which will help us to get special information from the ultrasound images, as it have a very complex structure. So it will have us to pay interest to the region of interest that we want in the image. The loss function, we use the log cosine loss because it has a very advantage of the non-convex nature of the dice loss. It helps us to smooth the loss curve. Also, comp loss is a cumulative of loss function of dice loss and cross entropy. For our results, this is a classification result using more than one model, and here we can see that EfficientNet and DenseNet are having the highest result, but we choose to go with EfficientNet version 2 because of the advantages we mentioned earlier, because efficiency and accuracy and number of parameters, which will help us in the production, deploying the production. EfficientNet version 2 results on each dataset. It implies that our model behave well in the high resolution images in these 3 datasets, with Bossy, Diat, and the last dataset. But on OSPOD, the images was full of noises and low resolution, so our model can't. Our results here are very low compared to other data sources. This is a test matrix of our EfficientNet version 2, and here we can see that the ROC curve and the confusion matrix shows that our model is generalizable and it has no biases to class on another. This great CAM uses explainable AI to show to enhance interpretability of our model, which indicates that our model gradient are paying attention to the lesion of interest, which our lesion tumors here in both benign and malignant. And we can see here that the photos are very complex lesion, and our model can behave very well in this complex lesion. For the segmentation results, we use the unit with different backbones, and we use attention unit with different loss function. And here we can see that attention unit and the log cosine dice loss are having the highest results for the segmentation. And this is the results of segmentation output on test data. And here you can see that our model can detect a small lesion or a complex lesion, or even the hyperechoic lesions that may be very hard to detect. Although our results were very good, but we have some limitation due to the nature of ultrasound images, because it has very high variability, which means that the benign might look like malignant and vice versa, which lead to our next limitation, that ultrasound require expertise to correctly assess the images. And also it's full of noises, especially the speckle noises, which hide important acoustic feature. Also, some images has a UI component and a black border, which will make our model affect its decision. Also, we in the classification board, we have the data distribution is highly imbalanced, so it will affect the generalizability of the classification model. But our solution to this was using data pre-processing. We used bilateral filtering to remove the speckle noise, and also we use image processing algorithm to remove the UI component and black border. And also we use the augmentation to minority class to avoid bias and improve the classification accuracy. And also to avoid any majority bias in the population, we use the appropriate loss function, which is cross entropy. This is an example from the removing the UI component and the black border and applying bilateral filtering to improve the resolution and also keeping the aspect ratio for the image. Lastly, we would like to express our gratitude to Astute Imaging for providing the technical and the research support throughout this work. Thank you all, and I hope you enjoy the presentation.